occupations, and it's like a medical competition based club. So our competition is community awareness, so we have to choose like a certain health topic. So we chose like how like isolation of elderly in nursing homes like affects like their health and like with like depression and stuff like that. So basically we're here today just to ask you a couple questions like to get some research on like on that. So really quick, could you like briefly describe like what you do and
Okay, so I'm glad you brought that topic up. It's something that we do a lot, and we help the community a lot with, and it's practically something we discuss daily. Uh, I am the chairman and the program director of the psychiatry department, a training program, to train psychiatrists, physicians that are doing their specialty in psychiatry, a Larkin Community Hospital in Miami. It's a very large program, one of the largest in the United States, and we do a lot of community service for patients who have dementia and otherwise mental illness.
Okay. So just to start with the first question, I just wanted to know, like in the elderly patients, is the feeling of isolation or depression like really prevalent?
Yes, absolutely. When someone, this is a very debilitating disease, and they go through a lot of stressors, and sometimes people think they're not aware, and they are. But when they have more of a social support, okay, with family that visit regularly, or when they're being taken care at home or in the nursing home, they have someone who is very caring, that can make a difference. And even sometimes when the individuals where they're taking care of them are very caring, and the family gets isolated, they do remember, they do sense it, they do miss it, even though they have their dementia, and it's very distraught, for them, and for the progression of the disease, it can become worse, and they can get very depressed.
Okay, thank you.
um So obviously the elderly require like more attention and more care. So like what are some things that you guys do at Larkin to treat these elderly patients and give them that extra care?
Well, for example, if we have them in the admitted in the inpatient unit, okay, because they get behavioral changes, they get behavioral disturbances where sometimes they're acting out, they get very depressed, or they get aggressive or very delusional, and we have to admit them in the inpatient unit apart from in the nursing homes that we go to. For example, having a staff that is very caring, okay, we put them like in a room, okay, which we call store. It's not a full-blown Jerry room where we're attempting to do that, but it's a Jerry area, okay, geriatric for elderly and with dementia, and then they are trying to be very caring. When they feed them, when they approach them, because sometimes if they're blind, they can get very very scared, or they don't recognize faces sometimes, or they think they feel threatened. So having someone who's caring, someone who knows how to really deal with them and dedicates the time, it makes a big difference for them to recuperate and to maintain that in the outpatient setting as well, in a nursing home.
Okay.
Activities, I forgot to say activities. Believe it or not, putting them to do little activities, to draw, give them little things to play around with, keeps them, with their mind, going, even though it's disorganized in what they're doing, and it makes them feel happy and take the edge off and the stress.
Okay.
What's the typical socioeconomic status of the elderly patients?
The ones that we see,
Yeah.
you're talking about like the type of patient population we see. It can range from one end to the other. Okay, I've had patients, that are coming from a very underserved area. Okay, which they have hardly any resources. Sometimes without having resources, like a patient that I have now, the family is very caring. Okay, and that makes a difference. And to the other spectrum, someone who's in a nursing home where they pay around $10,000 more a month, right? And they have, they live sort of like in luxury, and the care is very, very good as well. But they can come from different backgrounds, socioeconomic, underserved, middle class, poor, all the way to being super rich, to being very wealthy.
Okay.
Okay. My question is, do you think people bring enough awareness to the conditions that the elderly face? What I mean is like their mental states and the attention that they receive.
It's a work in progress. Okay. And that's why, we have attempted in our hospital, to reach out to that community. We have even scheduled classes to teach the caregivers in these places, us as physicians attempting to do that. And that makes a difference. So sometimes, sometimes you get lucky and you have the same person working for a longer period of time, sometimes not. Sometimes you have in one of these places someone who doesn't have such a high education, I suppose, like a regular, CNA or, not a nurse, somebody with a higher education, but they have a very high IQ or they're very caring. Sometimes you have someone who's educated and is not that caring. So bringing that awareness there is a challenge because it has to be a constant, ongoing situation. It's a constant, ongoing battle. Okay. But it does help to obtain it, but it is something, speaking for our hospital, which has a very good outreach program, but I can see it out there from other places. And of course, sometimes we attend these places, but we teach them, but and we bring them in house and give classes, but they have to attend because we don't own these places. You see, so it's reaching out to the community can become a challenge, and some other institutions don't do that. And it's there is a lack out there. There is a lack out there, absolutely, in some areas where and other places they don't. Other places they but there is absolutely. I went to a conference once that I was presenting, and I told my residents this because there was this place in Switzerland. One of the physicians was a geriatrician in Switzerland, and they have this sort of like a camp, okay, and it's it's really large, like a city in there, and they the Alzheimer's or any other dementia patients to roam around, and they can sit on the bus stop. They give them like little change, it's like fake money, and they go and buy like a little ice cream. They can hop on the bus. But all these individuals are doing that. The one that prepares the ice cream, drives the bus, the one that sits next to them on the bus stop, they're all really techs, technicians and CNAs, and they're caring for them, but allowing them to roam about and do their things and having the care and having scheduled visits with the family are limiting a lot of the use of psychotropic medications, which sometimes is very much necessary, but, with a lot of strategies that can be limited.
Okay. And I know this question might be out of your area of expertise, but do you know what the everyday life of an elderly patient might be like in a nursing home?
Oh, it's not out of my area. Okay, I can tell you. Yeah,
Okay.
I mean, like I said, it can be something that they can get adapted to. Okay, with a lot of strategies. For example, one of the nursing homes that we serve, right? They have like, apart from the cafeteria, they have like a common area, okay, where sort of like it looks like it's a little bigger, but like one of these outside like bars or something, but it's inside, and they have there like things to cook and to prepare coffee, Cuban coffee and all that, and the family are welcome to come. They have a very nice lobby, so the family frequently goes there. They're able to prepare coffee for themselves, give them juices, bring them stuff. And having that setting makes a difference. Having that setting makes a difference. A really nice place, right? Versus maybe other places where that is limited, where the patient is more on them to the room and then coming out to get the therapies whenever they're going to get it. So if that answers your questions, yeah, being in a nursing home, even let's suppose if they have some other type of disability and they're older and the family cannot take care of them, but they have their cognition pretty well, okay, it's still distressing if they don't have the love and the care, okay? And the coping mechanism that each individual has. You know, some individual has better coping mechanisms even within individuals with Alzheimer's, even within individuals with dementia, and having that is important, having the support and having the right places. But it is challenging for them. It is challenging for them. That's why a good place makes a difference, because if they have love and care, there's nothing like home if they have a caregiver at home. But if they have for example, it doesn't have to be even a child, a husband who's very loving and doesn't have dementia and can still drive and go see them every day, like we have some in nursing homes, it makes a difference. You see, I have seen a patient that the husband has gotten sick with a dementia, and people think she's not aware. He hasn't come around for 3 days, and she's in distress, hysterical, crying, acting out. So it is a distress when they get out of their environment, especially the dementia can progress a little more because you don't see it that bad on some of them, because in their house they have lived there for so long that even though they're losing their memory, right, and other type of cognition abilities, they are able to go about because they know that area. When you put them in a different area, think about it like if you get one of us, for example, and we get on a helicopter and I throw you in the middle of the Amazon jungle, how will you feel? That's the explanation.
Okay. So, last question. So, what can be a way to make these elderly patients feel less alone?
Having good caregivers, having caregivers that are well trained, especially apart from early on in the disease when they're in a lot of distress and they need a loving hand, loving face there to help them out, to the point where they have to change them frequently, clean them, get them off from the bed with help because they cannot ambulate anymore, with a jack, and assure that they're clean, not let them be about there, on their own soil and urine for a while. They start getting a lot of urinary tract infections. Someone that comes about and when it's going to approach and pass, to clean them, pat them a little bit, reassure them, make sure that they have a good doctor, a good primary care physician that's in charge of their medication, a good psychiatrist in charge of their medications, and to review them frequently so they're not over medicated, not just keep the patient medicated, have them in a place where they can give them activities, okay, where they can go about, maybe little trips, like a nice patio outside where they can go. Sometimes they even bring animals or plants, or make them do little things, little workshops, and even dancing and songs, and that helps with constant activity, keeping their day busy, and ensuring they have a good treatment plan.
Okay, so I think that's it. Those are all the questions. I don't know if anybody from my group wants to add anything else.
No, I think that's good. You answered all our questions perfectly. All right, thank you so much. We really appreciate you coming. Yes, thank you so much. We really appreciate it.
You guys. My pleasure.
You too. Bye. Thank you.
Bye.
Bye.
Let me stop recording.
Yeah.
Great work, guys.